Fraud within the healthcare system does really matter. It's not just stealing from some unknown HMO or health plan or someone that you don't know. It's not the little guy just trying to get by, making a couple of extra bucks. There's a famous case in Colorado where a woman's purse was stolen, and in her purse was her medical ID card, and it was stolen by a woman that was pregnant, that was also addicted to heroin, that was about to give birth. And she used this woman's ID card to go into the hospital and have a baby that was also now addicted to drugs. And the hospital reported this woman to the authorities, who then came after the woman whose purse she'd stolen and was sending letters to this woman about having her children potentially taken away from her and put into some kind of foster care, because this woman was pregnant with other children and also a heroin addict. So this was a case of medical identity theft. The woman eventually got the situation resolved, that it was just her and her purse. But in the meantime, there was great stress to her and her family. There was great stress to her children. And she spent $20,000 to $30,000 in legal fees trying to get the situation rectified. So medical identity theft, or having phantom claims put through on your medical identity. And what we mean by phantom claims is the claim didn't really exist. The pharmacist is taking a patient's ID who does not walk into the pharmacy and does not get a prescription, but they take that identity and submit a claim to the insurance company or to the health plan, who then adjudicates it, and it becomes part of your permanent medical record. And there's other situations where if a fraudulent claim is put through on your record, and let's say you're a professional, and certain professions, you can't be a drug addict, a former drug addict, you can't be you can't be treated for depression. If you are treated for those and it shows up on your profile that, let's say, you're a Suboxone user, when indeed you're not a Suboxone user, which is used for addiction to drugs, this can have a negative effect on your profession. So medical identity theft and pharmacy fraud is not a victimless crime. It's just not getting a few bucks out of an insurance company. And let's face it, even if you are getting a few bucks out of an insurance company, that insurance company is just going to raise everybody else's premiums. And if it's a Medicare or Medicaid program, then there's not going to be the available funds for those government programs going forward. So healthcare fraud is a big deal. It's 1 in 10 claims processed every day through every PBM in America.